Clayton, come on here. I think there's Kathy over there. Whether it be Mitch or JB or maybe other senators or delegates and everything, and all y'all. Okay. Here, I think, let me lead off by just saying this. We just got off the phone on a video conference right from their cabinet room. There's a lot of good information that they were passing on to us. Basically, the information to me surrounds just this, and that is, without alarming anyone, the seriousness of this continues to be real, and the seriousness of this outside of our borders pending. We do not have a positive case yet. Now, from time to time, you know, we constantly are having, well, I know there was one at Mon General, or I know there was one at Raleigh General in Beckley, you know, or I know there's one at Cabell Huntington, you know, or you know, wherever in Huntington. And yet, when the tests are really run, we're coming back negative and negative and negative, which is great news, great news. The only thing I would caution us all about is just this. And now is where really and truly I've got to be your leader, and I've got to be the adult in the room for sure. You've got to realize just this, that if all the powers to be throughout this nation did not believe the gravity of this situation was as big as it is, they would not be doing what they're doing. In our state today, we have been really blessed and sheltered, but we should be concerned. We should really be concerned because we're an elderly state, and those that all of us that aren't elderly, a high percentage of those have health issues, you know. And so if this virus were to aggressively attack us, we are a very high risk population. So we've got to be concerned. Don't be asleep at the switch. And that's why everything that started with preparedness and went to proactiveness is real that we're doing. Now, that's why I canceled the state tournament. That's why I canceled schools. That's why we're doing all the different stuff from the nursing homes and right on down the line. This is serious stuff. It's really serious stuff. In the state of West Virginia, I do not want us to be asleep at the switch because we just happen to not have a positive test. And I don't want us to look to the positive test that finally comes as somebody winning the bingo game. I mean, for crying out loud, we don't want any to come. You know, we don't want anybody to, you know, be the star of the game show because they were the hospital or they were the person that got, you know, that was the first one. We'll go through a lot of different things. I'm going to tell you just, I'm going to hit the highlights and then I'll let you ask questions and everything else. The bottom line is our president is urging all of us, as I am urging all West Virginians, stay calm, be smart, use great hygiene, take care of people that are the elderly that you can help. For crying out loud, you know, go to the grocery store for them. Absolutely try to look after them. And when you're with them, use the very best hygiene that you can use. Wash your hands. Stay at a distance. Use smart, good sense. Today, we're telling everybody to stay away from crowds as much as you possibly can. Don't go to gatherings that have in excess of 50 people. Now, wait a minute. 1, 2, 3, 4. I want to make sure. But all of that being said, the things that we don't need to do right at this point in time is make a mad rush on the grocery store. I got a text from a lady, and I don't make light of this and everything. She said she was at a grocery store and the buggies were full and lined up all over the place, and there was nothing left on any of the shelves hardly. And she said a lady right behind her, had 15 gallons of milk and said she was going to freeze it. And the guy in front of her had 30 loaves of bread, and she looked at him and said, "Am I missing something here?" And then all of a sudden the guy in the back says, "It's going to snow tomorrow." Well, we don't need to panic. Our president assured us today that he had been meeting with Publix and Walmart and Kroger's and all those people and said absolutely, without any question, we don't have a food supply issue. There's going to be plenty of food. There's going to be plenty of groceries. You don't need to make a mad rush on the grocery store. Just settle down. That's okay. Now, any person that would want to be tested, the federal government has come out and said without question all the cost would be covered on any of the testing. So you don't have to worry about having to pay to have testing. Today I'm going to declare a state of emergency for all 55 of our counties due to this outbreak and following just the follow-up from President Trump's declaration of a national emergency. From the hospital standpoint, I'll get back to that in just one second. We're beginning to work on personnel policy and people coming to work, and basically I have mandated to all of our agencies that let the experts work on their own type plans. You can have people working at home, working on computers, working at home. All that would be great if they need child care or whatever like that, and they need to stay home with their kids, or they're worried, or they're elderly, or whatever it may be. We'll be working through and developing programs that will enable our people to be able to work and still get all the essential stuff done and do it in a way that is the most advantageous to all of us. Clayton will be telling you about school updates. This is one thing that we can be super proud of, and it's the fact that today, Monday, when all this started down the pike, we had more than 500 sites around the state that began operations to ensure that our children who would require school breakfasts and lunches would receive meals during the statewide school outage. It's amazing. And you got a lot of people that are really, really stepping up, and whether it be the great school personnel that we have, service personnel that we have, and all the great work that they have to do and everything in order to be able to ensure that we're able to do this. You've got not only that, but you've got religious groups and everything else that are jumping in and really helping in every way, shape, form, and fashion as well there. All schools will be closed until at least March 27th. We'll reevaluate as we go, keep people updated. I want to commend our Attorney General for his actions to combat fraud and scams and price gouging and all that stuff that's going on. Charlotte Lane, our chairwoman of the Public Service Commission, is doing a great job to try to give some guidance to the utility companies to say, look, you can't cut off somebody's utilities right now and everything if they're a little bit late paying their bill and all that because this situation is going on. And you've heard the health tips, and then I've got one last thing and I want to tell you, but I just want to make sure that it says, wash your hands, cough into your elbow, don't touch your face, and you see me nonstop touching my face. So, it's a bad habit and everything, so just do the best you can do and go and try again to wash your hands as much as possible. Now, one last thing that I'd like to tell you is just this is, I came up with this idea and we're floating it around and we're really working it right now to just see that there's resources that we have around the state, like the recent, it looks like the closing of Fairmont Regional. Well, Fairmont Regional is going to close for a short period of time, probably 30 days. And in that 30-day period, there's going to be a transitioning of equipment that's there, moving that equipment out because it's got all kinds of liens and everything against it, and lots of problems there, and moving in equipment, newer equipment, everything from WVU, all the medical records and all that kind of stuff, and the processing, all that. It's going to take about 30 days to do that, and getting the proper CONs and all that kind of stuff in place and everything, where then WVU can reopen the hospital and Fairmont General can run, or Fairmont Regional can run until, basically bridging for 24 months or so till they build this new hospital, new 100-bed hospital that the WVU is going to build in the area. And that was a great, great, great outcome from the standpoint. And just tell it like it is, guys. In the beginning, what that was it was a 10-bed hospital, emergency room, step-down deal. And all of, everybody that's here surely knows my position on it. My position was just straightforward as it could be. I'm not going to tolerate that. I'm not going to have that happen if there's any way in the world. So I stood really rock solid on the fact that the 7th largest city in our state can't do without a hospital. That's all there is to it. I mean, and so lo and behold, all of us got our heads together, and WVU was great, and they worked really hard at it and everything else. And now we've got a full service, brand new hospital going to be built right there in Fairmont. Can't be any better. All that they'll basically employ more people than is at the old hospital. All new stuff. Great outcome. The only reason I go through that is just this. In that window of 30 days, or maybe it takes 6 weeks, in that window of when that hospital may not be open, that hospital, the Wheeling Hospital, the Sistersville Hospital, there are resources in this state that what we need to do is move on right now, and try to get in all the supplies to those hospitals that if we were to happen to have an outbreak, we would be able to move people to those facilities and utilize those beds. And there could be as many as maybe 400 plus beds, and we could utilize those beds with docs that are already there and properly equipped from the standpoint of protections and all that kind of stuff to be able to take care of those people in a better way there if our other hospitals became, covered up or whatever it may be. So with that, all that being said, we're still trying to do every single thing in a state that doesn't have one positive confirmed person yet. We're trying to be ready if we have a rush on everything, that we'll have facilities that we can go to. We're trying to be ready in every way we can possibly be. You got a lot of people doing good work here and all that kind of stuff, but my last words would just be just this simple. Let's not get caught, and then say, oh no. Let's err way, way, way to the safe side, way to the safe side. The greatest thing that could happen is we've overkilled the situation tenfold, and then really and truly at the end of the day, we didn't have a great big bad thing happen. So,
first of all, are you concerned that West Virginia didn't receive resources from the federal government with the problems with the test rollout? Also, has it left people in this state who are vulnerable to getting sick because we have an older population? Has it left people more vulnerable because our testing per capita has not been what we've seen in surrounding states?
Okay, I'm gonna let Kathy probably go into this more, but I would just tell you this. I think what she's going to say is, we've tested now 84 people, okay? And Ohio has tested 100 and change. And their population is 8 times as much as we are. You know, we're pretty much ahead on the testing.
But it wasn't until today. We did a story yesterday that showed the numbers were behind in West Virginia. So
I don't have any way to do anything but that. On the call, the governor from Washington State said, we need more resources here, and why in the world are you continuing to send resources to West Virginia? They don't even have a case. On the call, you know, and I don't remember specifically just the detail, but just this is, you know, the president said to me, he said, you know, what are you doing there, Jim, to keep you know, to have nobody test positive and everything? And we kind of smiled about that and everything. Everything on the call was really, really serious. You know, from the standpoint of, you know, and surely it's been mentioned upteen times about our elderly population, our population of people that have worked in the mines, COPD and, you know, obesity and diabetes and all that kind of stuff. You know, Amanda, the one thing that I really believe this is, so I'll let Kath.
have you received fewer tests in other states? Because there are people who wanted to be tested. I know everybody can't get tested, but there are people who want to be tested and have had some valid concerns, and they've been told no.
They are valid concerns, and they're real. I would love to be able to test everybody. We have pushed out, we're currently testing folks that are seriously ill in hospitals, because that involves the infection control parameters of how the hospitals work, vulnerable populations in hospitals, and then also those that have a high risk of having been actually exposed. We've been pushing that out. We're increasing, so it's better than it was. But here's the reality. Currently, I have the ability, there's all kinds of things in the chain of testing. There's swabs, there's extraction things, et cetera, et cetera. There are shortages on many pieces of it. So currently, I have enough tests and supplies and everything else to do maybe 500 people.
Are we being treated differently?
No, we're not being treated differently, but I think we are a small state. We have a minimal supply. That will ramp up if I can get pieces of things. So I think we've got the ability to increase it. But the key is none of it's enough. So, and we've been promised that we're going to be having commercial testing, et cetera, and it's not ramped up yet. We've been talking to hospitals and their ability to do testing, and they're working on it, but they too are hitting issues. So the good thing is the federal government did over the weekend talk about a whole new model of testing, because they're hearing this from every state. So, because what we all want to do is community-based testing, not this targeted kind of testing. I mean, Virginia is shrinking down their ability to do testing and who they can test even further than we have. So we want to all do more testing. The federal government is talking about a model in which we do community-based, let you have come, and we actually done some planning in advance around those kind of things, like we would do mass vaccination, we could do it around testing. So we've got counties planning for how to do that. They asked, if we sent them our request on Saturday to say we will be happy and active to do any of that if you get us the supplies. We don't need to wait even for you to come and help us do this, because they're going to roll that out in different phases. And the first 12 states they're going to, it's not West Virginia. So I said, we don't need you here, send us the supplies, and we can do it ourselves. So we've put that request in, and we will work with them on everything they can get. We have called, we have begged, we have asked.
How long will 500 tests last?
Well, it depends on how many people flow in. So if the current rate, it would probably be a couple of weeks.
Are we only testing people who have traveled overseas?
No, we are testing the one that we're seeing most now are the seriously ill folks in hospitals.
Our guidelines are more stringent, though, than states that are surrounding us. They've closed things down there. Those people could be coming here because they
Right.
don't have the opportunity to go to a restaurant. I mean, is that something that you guys are able to say to the federal government?
Actually, our guidelines right now are more expansive than Virginia's. They've scaled theirs back. So what we're testing right now is a lot of the seriously ill folks that are hospitalized, near hospitalization, because it's going to impact the way that hospitals can handle those kind of things. The travel is not so much international. The travel that we're doing now more is, or the testing is not around travel, it's around have you had close contact with an identified case, a confirmed case, or travel to a domestic area that's at high risk. So it's more around that now that we're doing. So the two priorities, big picture there, are folks that have the highest risk of being actively exposed to a known case or a high-risk community. And second, the seriously ill in hospitals or near hospitalization that are at high risk, elderly and diabetes and chronic disease kind of things. So those are the two that we've done. Are the two ones that we're prioritizing. No, it's an either or. It's an either or.
Why is there a shortage? Are we importing our supplies from somewhere?
I think they're getting used worldwide, probably. There are importation issues, most likely. There's been a big demand on these. Folks are running out.
And I've heard that the same sort of, you talk about different parts of the materials. I've heard that some of the materials are also used to test for flu. Is that right? So that's part of the issues that we're including.
The reason we have those 500 ability right now is because I've pulled all my supplies from flu.
So are we unable to test for flu?
Well, we will do it for a few days. We will do.
Are you concerned about?
We've only got a handful so far from them.
Governor, many of your contemporary governors have now fallen.
We've got to keep on some way living and doing what we're doing. And I don't drink, so I'm not in a bar hardly, never. But at the same time, I don't think any of our people yet believe that is necessary to do. And so if we don't watch out, and it may very well be that it comes to this, but at some point in time, if you believe, what our federal government and our federal people were working on today, they believe without question that if we don't have the supplies to do the testing now, we'll be getting the supplies. And we'll get the supplies, and the federal government is all over achieving that. As far as closing down gatherings, hopefully at a restaurant you're not all jammed in right on top of one another. And the other flip side of it is hopefully we use good sound judgment and say, at the same thing with a bar, that from the standpoint of going and interacting with an elderly person and everything, that we use all the hygiene, and we may, just like with what happened with the schools, I was not an advocate on the first day of closing the schools, but then very, very quickly after that, the very next day I closed the schools. And it may be that we have to do that too.
I would like to respond to Dr. Slimble on that question as well with the bars and the restaurants. Do you have any additional comments?
You have to, we may go to that spot at some point where, right now you're looking at how can they function in ways that, again, you don't do the congregate gathering. People be further apart in smaller groups. Every sector of society needs to be thinking about how do we do social distancing. So it's not necessarily about closing everything. It's about doing what your mission is, your critical mission is, in ways that are safer and more effective.
Without the ability to test as many people as we want to test, would it not be prudent to shut things down because we don't have that ability?
Well, we actually, and I think to the governor's leadership and others, we are moving forward as not related to how many tests we have positive. We're moving forward based on just assuming that it'd be here and we'd be proactive. So we are not waiting for that because we know that the two things ideally that make the biggest difference really are, one, those social distancing measures, and that we all pitch in and do them. So all of us take part in that. We all think about the creative ways that we do that. If you can get 70, 80, 90% of your population doing that, you can make a big difference, what we're seeing from other countries. And then the other thing that can make a difference is if you can do widespread testing so you quickly identify and can follow up. So I am excited that they've got this plan to come forward. I think that's got great potential. and that's wonderful. We do need those supplies. I think that we need, the message we keep saying forward is you need to be prioritizing states not just on numbers of cases, but on risk. We have a high-risk population. If we don't have a lot right here now, that's great. If you send them now, we act now, we have a chance to really reduce it much more. If you send it just where it's already happening, you may be too late.
Dr. Slum, can you clarify for me, is the virus actually airborne?
They're learning more about it. For the most part, they think it's respiratory droplet, but they are exploring could there be any other means. Probably the majority is respiratory droplet. They're exploring that piece.
But still, doesn't that make you concerned about the limited testing? Because people could have this, and then if they can't get tested, I mean, they could be spreading
Yeah,
it.
I think you have to make the assumption that when somebody is sick, they have it, and you manage it. When these situations happen, you start to manage them with the assumption that they are. But again, I mean, it is reassuring that the 80 that we've done, including high-risk folks in hospitals that have been severely ill, have been negative. So that is reassuring. And we need to keep doing more, and we're pushing to just do more. And I would encourage providers to send them in according to those guidelines, get them in, we will keep them being tested. I mean, we've gotten really good, our folks were here at 5:30 or 6 this morning starting, they've been doing runs this morning again already, so people are working really hard and we're keeping up so far with the turnaround time.
I want to follow up on my question about your frustrations. Are you frustrated about this, and can you just briefly talk about what you pulled from the supply to check people for flu, to check for COVID-19? If you don't mind to just kind of
Sure.
clarify that. And are you frustrated with that? That's my first question.
I think we're frustrated as a nation with that piece of it all. It's
Specifically here, that
sure, we're all frustrated with this issue, and we do the best we can. We pull together, so we will keep doing that. And we've talked that the hospitals are working towards trying to get testabilities with new and different kinds of tests that the FDA has made available. So they're working on that. They actively are doing that. So we've got places that are really looking to try to expand it. LabCorp is here, and so we've been in contact with them. And they say now that if a provider has a LabCorp contract and they don't have supplies, that call the representative and they will get them some supplies there. There's great potential for the broader community-based testing. And I think there we start to look at things like, could we prioritize folks like if they've been sick, healthcare workers, first responders, elderly. So you want to, you would start doing the folks that it changes how they, like your healthcare worker, if you can rule it out, you can get them back to work faster. So you start to do those kinds of things. So there's great potential in moving forward, and I think it will change. But it is a really frustrating part right now.
talk about
What's the timeframe? I mean,
Governor,
we're
what
gonna see
does
this
that
stuff in weeks or
state of
days.
emergency mean? What powers does it give you? And how exactly would you close a private business? Or what part of the code, or how would you get that authority?
Bill, you got to answer that, or some.
That's probably a Brian Abraham question. As you know, Governor of Ohio did that. There probably is requirements or language in the statute somewhere that allows the governor to take that kind of action. But here comes Brian. He may be able to answer that for us. Does the governor have the power to close private businesses?
The state of emergency that the governor's issued is relaxing the authorities that our commissioners, directors, and secretaries have to enforce policy and regulation. There's nothing in this executive order that the governor granted any power to himself. There's a constitutional question as to whether or not we can seize private businesses as a threat that they do certain things. Keep in mind, there's reporting in the media, I think, saying governors are directing and requiring, and a lot of that's been requests that these businesses curtail or shut down. Some of it has been, and some of it has just different constitutional abilities to do so. But what we've done with this is we're allowing our agencies to work with our businesses and relax regulations.
Would an emergency declaration allow Secretary McWhorter to do anything, changing elections, pushing back elections, looking at the effect of the primary?
I really believe right now, as far as worrying about our election, that ought to be way down the food chain right now.
What do you guys have to say to anybody out there who might think that this is still maybe not a big deal and that the media might be blowing this out of proportion and they don't really need to self-isolate, all of that kind of stuff? What do you guys have to say to them?
That'd be the greatest news that I could possibly hear. That's all there is to it.
But the
If at the end of the day, all we did is go through all the exercises to really make ourselves prepared in a better way or proactive in a better way, in a better way, in a better way. And at the end of the day, the tsunami didn't come as big as what everybody's afraid that the tsunami is going to be, then I'd be real happy.
But the governor said it well, is we have no positives, but we have to take this seriously. Our citizenry needs to take this seriously. What has worked in other countries is simply more testing and social distancing. So we have an opportunity right now. We have almost a window here that if we can push that out, and we need the press to help with that, push that out so that folks understand they need to take care of themselves, they need to take care of their families, they need to take care of their parents, their grandparents, and their great-grandparents. They need to shop for them, keep them out of crowds, out of grocery stores. Take care of your family. If we can do that, and we can take extra caution in terms of how we handle our own health habits, and do not spread what we may not have, we may have. But if we can do that, we will have a difference. We will make a difference with this.
I think it's, take it seriously and do your part, because we all really can play a role in that. And I think we take that nervous energy that we have around this and channel it into effective action.
Dr. Slade, I want to get back to have you clarify your talk about the flu. The flu is obviously very serious, deadly, but you talked about taking resources from testing people
Right.
with the flu to deal with COVID-19. Can you please clarify what you meant,
Sure.
what you're doing, and will people not be able to be tested for the flu now as a result?
So it's a temporary thing. One of the pieces
Is
that
it acceptable?
One of the pieces that we are, that are in the chain of supplies you need for testing is our extraction kits. We've ordered those, but they're on back order. And so we don't think that they are going to come in. And we've also ordered them commercially, and they're on back order, coming in the next couple of weeks. In the meantime, I borrowed extraction kits from my flu testing to fill in, to expand my capacity. We think they will come in within a couple of weeks, and that will double my capacity again to do testing. So I'm not stopping flu testing. In fact, it's actually really helpful for this because we try to get to exclude flu before we do COVID testing, because then we can conserve our resources more. So I'm not stopping flu testing. We borrowed some supplies short term while we try to get some other supplies in. So we will continue that.
Any extraction kits from the federal government at all?
No, we have received some. We have ordered more, and they haven't come yet.
How many have you received?
I don't know the exact number, but I know that we'd like more. I don't know how soon they'll be here.
Is there any delay getting results from LabCorp or issues getting results from LabCorp?
No, we actually are electronically connected so that when they get a test and it gets into their electronic system, we automatically get that. And in fact, typically with diseases, we ask them to report the positives. We've actually asked them to report the positives and the negatives because I want to know how many they've tested.
Governor, you were talking about borders earlier. I mean, we have people that live here that work in Virginia, D.C., Maryland, Ohio, Pennsylvania. Do we have any special strategy to deal with border counties and people who might be bringing things over?
West Virginia is just a collage of border counties, period, when it really boils right down to it. Naturally, we're concerned about people living in West Virginia and going to Virginia and coming back. But you've got to understand just this now, and again, I want to do my job. I want to do my job right now for everybody. I want you to really listen to it, okay? We're all concerned, and it's awfully easy to go running in 50 different directions and everything get out of control. As far as our restaurants and our bars, that may be a situation that we address soon. As far as shutting down the Capitol or shutting down our cities or whatever it may be a situation we have to address soon. You've got to understand, this virus is without question in West Virginia probably somewhere right now. Whether we go back and forth to Virginia or not and everything is an issue, but it's here. But I want you to just listen to just what I've already said today. And I made 2 or 3 notes here and everything just to be able to not miss this. Today in West Virginia, we have 84 people tested and 80 negatives and 4 pending. Today in West Virginia, I would say to you, the federal government and everybody is saying, go to the grocery stores. For crying out loud, go to the grocery stores. If you want to go to Bob Evans and eat, go to Bob Evans and eat. You know, if we get to the point in time where we've got to close the grocery stores and drive a truck around and whatever and bring groceries to people and everything, we'll do that. But today, don't have a mad rush on trying to buy all the toilet paper in the store. You know, we'll get by. The other things I've said is your testing is, there is no cost to your testing. And if you're sick, we got to get you in and test you. You're hearing from Kathy in every way, shape, form, or fashion that, and from the federal government, that testing supplies are behind. Naturally, she's frustrated. We're all frustrated. Everybody's screaming to the top of the mountain and everything. We need more, we need more, we need more. Everybody's screaming that. For God's sakes, a living, let's just tell the truth. We got in a situation where 96% of our antibiotics were made in China. You know, now, everybody's caught. Everybody's caught with a dilemma. And everybody's running playing catch up right now. We have declared a state of emergency. We are working on a personnel policy. We are working on the fact that these hospitals that have beds, we're working on a contingency plan to do something with those beds. We're working on what to do with capital restrictions right here and what to do there. You know, we're absolutely doing an incredible job in feeding the kids on the very first day. You know, now our Attorney General is all over this scam deal or people price gouging. The Public Service Commission is appealing to all the utilities to don't shut somebody's power off. We've given you all the health tips under the sun. And I would go back to just this. Surely, we've got to just keep screaming and screaming and screaming. We're an elderly population. We're exposed. We've got to have more testing abilities. We've got to have this. We've got to have that. That's what we're doing. That's what we're doing to the highest heavens. That's what we're doing. But we can't stop living. We can't stop living at this point in time.
Governor, can you clarify what exactly does a state of emergency mean for West Virginia?
Well, I've got to defer more to Brian Abraham on the official capacity of that. But from my standpoint, it was more of a follow-up from a national state of emergency. And then if you declare a state of emergency, then there are certain things within the state that become freed up and able to move easier. Now, all those particulars, Brian is going to have to tell me.
Can you clarify exactly what a state of emergency means for West Virginia? What does that free up and how will that impact people?
Well, under this order, it's Executive Order State of Emergency. It allows the governor to suspend certain laws and rules that we have in place. So purchasing issues, personnel issues, different types of regulations. So what we did in this one, first we declared all 55 counties a state of emergency. There's an issue we have going right now with the Small Business Administration. Reached out to us this morning. They need a declaration that our businesses and our counties are affected so they can put certain of their procedures in place. So this was necessary to effectuate that. With respect to the overall idea of this executive order in a state of emergency was to allow our secretaries, directors, and commissioners the ability to waive certain rules and regulations as necessary to deal with the changing environment.
Can you give us some specifics?
Our personnel rules, for instance, would be one, and as the Governor mentioned, we're working.
Or the purchasing rules that we talked about before.
Right, so if we have an agency that needs to buy supplies, normally they'd have to go through the prolonged purchasing process, putting out a bid, et cetera. This frees them up to immediately go to the street and buy those supplies. Personnel rules may say that we're going to now relax the time requirements to be at work or how we work or sick days and deal with those. So it's pushing that out throughout our state. As we deal with businesses or agencies that or places that we regulate, it allows our directors or commissioners the ability, because maybe our hours are affected, the way you come in and apply for renewal for a license or an application for a license It may be some timeline gets extended based on a case-by-case basis. It's just freeing up our agencies to do business with our public in a way that's more consistent with common sense.
And can you give some specifics specifically for small businesses? I know a lot of people are really, really concerned because small businesses often deal with person-to-person interactions that are not necessarily happening now.
Well, this would, as our agencies go, again, allow for, if there's some hardship on a business caused by this event, the agency would be allowed to release or waive certain restrictions and how it deals with that business. Now, as far as how their business operates with the public, this won't reach to that. That's a public-to-customer relationship. So this is only going to relate to how the government does business with our entities that we do out in the public.
Can I make sure we don't miss something here? So, a few years back, we established a change with the state of preparedness and to augment our state of emergency. So, I just want to make sure people understand. The governor, several days ago, a week or two ago, we established a state of preparedness so the Guard and other entities could have more flexibility to work together. So, I've got LNOs in his shop helping with school food delivery. We've got LNOs in DHHR helping with the preparations, planning, and those things. So I think it's important for us to put in perspective, this is just the next phase of the governor's ability to provide more flexibility and more resources for state government to take care and support people. And the state of preparedness was designed to go back to the governor's point of, we got to use this as an opportunity as the citizens of the state of West Virginia to be better prepared for not just this, but for anything else that comes along. So one of the things Clayton and I talked about with Kathy and Bill this morning was, we know that school kids who are out, who may not have connectivity, normally go on to public TV. So we're going to go reach out on the public TV and put some more messaging out on things to help families prepare, medical surveillance, and those kind of things. So these are extensions of the governor's ability as the chief executive to bring all of us together and make us more focused on what we're supposed to be doing.
Yeah, but if you could touch on how food distribution went today throughout the counties.
I think Clayton I think it went great.
Sure. We had over 505 sites ready today at 8 a.m. to begin food distribution. I will tell you that in a 48-hour period, when the governor announced the closure of school, the number one priority put to us was to make sure the children were fed on day one. And we can say unequivocally it was done. General Hoyer, the Guard, has stepped up and helped. I think we have to give a huge shout out to the service folks that stepped up, our cooks, our custodians, our bus drivers. But even though our teachers are charged to be preparing for these lessons at home, across the state, I've heard stories of teachers showing up today to help. And I think these good stories of our community and us just being true West Virginians was a prime example today of making sure every one of our children had a meal.
Governor Justice, the president during a news conference that's happening right now just recommended nobody get in groups of more than 10 and limit discretionary travel. Just looking at these notes here, what are your thoughts on that?
We need to dismiss, don't we? All right, now just listen. Let me just hit the real highlights one more time. I would tell all of us in our state, be concerned. Know this is serious stuff. But at the same time, it doesn't help any of us to be afraid. You know, try as best you can to live your life in a smart way and using great heights to test somewhere. Let's just hope and pray in every way that, again, all the good work that these people are doing, and I will promise you we are on this every single minute of every single day. Whether it's getting the kids fed or whether it's absolutely doing all the right things that we can do as far as the testing, whether it be the right thing as far as finding the hospital beds in case we have an emergency that we can go to, but we're on it. We're on it as the very best we can, and I would ask every West Virginian to do just this, and then we're done, and that is just this. Help each other. Look out after. Be great West Virginians. Be the people that love one another and try in every way to be smart, to use great hygiene, and help especially the elderly in every way. Now look, we're going to get through this. We're going to get through this, absolutely. Let's don't panic. Let's don't be afraid. Let's just get through it and everything.
Is this a time when you need to, you have this relationship with the president? Is it a time when you need to pick up the phone and call him and say, we're not able to test the way we need to?
Listen, I want you to know that from Kathy's standpoint, and Kathy's a superstar here, from her standpoint, we are not behind in the testing. I know if you look at 1.8 million people, for God's sakes a living, you'd like to test everybody, you know. But if you compare to what an Ohio or whatever's doing, Kathy would tell you we're not behind. But I would tell you we're working like cats and dogs to be able to get more and more and more and more supplies here, just in case we'd have a run that we'd have to do more testing.
How were we able to double the numbers overnight of cases tested?
With folks to especially on this hospitalized arenas, to get folks to send things in. And they picked up on those things and they've been sending it in
Keep in mind,
more.
if we had 2 and we went to 4, would you be concerned that we'd doubled the number? I mean, we were at 40 and we went to 80. You know, I mean, 80 compared to our population, and I hear exactly what you're saying. We need a whole lot more kits. We need a whole lot more testing abilities and all that kind of stuff. We're working it. We're working it.
Governor Justice, on the call with governors today, President Trump instructed governors that they should work on trying to find more ventilators and respirators themselves. Ryan Abraham mentioned purchasing earlier. Is that something you're working on?
We're absolutely working it, but I think that Bill and Kathy both would tell you that they have almost exhausted that. And and on the call is, am I correct in that?
Secretary Azar was on the television last night on the press conference who stated publicly they have thousands of respirators available at the federal level and have only had one request from one hospital for a few. That was last night in a press conference.
And let me follow up. What I mean by this is this. From tasking the private sources and whatever like that, the federal government, here's exactly what they're doing. They're saying, now we want y'all all to look privately as much as you can before you come to us, but they're also saying to us, we got a mountain over here of them.
So have you started doing that?
Absolutely, absolutely.
Dynamics and logistics of testing aside, I know it's very important, but that aside, if we had a confirmed case today or yesterday, what would we be doing differently than we're doing right now?
We're doing the right things now. You know, I think we're expecting to see a case. Why would we not? And you know, it's no magic difference between day 1 and day 2 when you see a case. Most states, when they start to see cases, that does rapidly go up. And that would not be surprising. But that's why we're putting all those things in place now and asking everybody to really pull together to do everything they can to prevent that. I think, you know, and the governor is absolutely right, you know, and I really appreciate his leadership with this. This really, you know, we have to pull together as a community, and we have to together think about creative ways to function and do our regular things. It's not about closing everything. It is about doing things that sustain those operations, that sustain that connectedness among people in smart and different ways. And so I think that is what we can all do to take care of each other and ourselves and our families.
Gatherings of more than 10 people are discouraged when we think about businesses, factories, things like that. What kind of guidance is the state going to give these organizations?
There are a couple of things. The mass gathering thing, the large groupings and community kind of things, that has to do, and CDC came out yesterday with some guidance around 50 or more for the large gatherings. The 10 is about small meetings that you get together otherwise. It's safer with groups of 10 or under in general. So that's if you were doing a church gathering of something that was 10 or family. You know, the more that you've got smaller groups of 10 in the same group of people, the less you intermix. It's all about not mixing folks in and out. So if you've got the same group of 10 or 12 that you're working with and you're there every day with each other, it's a little bit less chance of exposure, et cetera. So it's just all about not the intermixing. So the 10 is more for a small grouping, gathering kind of things.
All of these issues, again, have to do with reducing risk. If you think of it in those terms, what we're doing is just reducing the risk everywhere we can of the transmission. So keep that in mind as you move forward. Again, I want to say I appreciate, we had a couple of reporters who have put our website and the number in your articles. We appreciate that. We need to get that word out to folks and make sure they have access to information so that they understand what they need to do and what they don't need to do. So if we look at folks being distance of 6 feet from each other, we look at social distancing, you can still get together. You can still talk to folks. You can still have gatherings. You just need to be a little more cautious and aware of the potential there.
It's spring soon. You know, getting outside, walking around is a good thing, a healthy thing. Talking to your neighbors across the yard is a healthy thing. All those good things. Visiting a state park is a healthy thing.
Governor, you said last week that you would hold these press conferences every day when I asked you, but over the weekend we heard nothing from you as far as press conferences go.
That's unfair. If you'll go back and watch the tape, I said we would not be meeting on Saturday or Sunday and, you know, and everything, but we will. If we have confirmed cases or we have an emergency, we will come in on Saturday and Sunday. I mean, we worked and we talked 5,000 times and all that kind of stuff. Everybody's still working nonstop.
Right, but you did just say that you're, you know, acting as if we do have a case here, and, you know, you just said that if we had a case, we'd be.
No, we don't. I believe without question it's here. I believe that and everything. We all believe that. But we don't have a confirmed case. We don't have a positive case. Now, that's not going to change much of anything. You know, just like Kathy was saying, that's not going to change the world. You know, we're still going to react because what we've put in place, to the best of all of our abilities, we've put in place what we think was the best moves we could make. Closing state tournament, closing schools, doing all the different things that we're doing that we've already outlined here without repeating it all. We're moving in such a proactive way, we think we are absolutely doing everything that we can possibly do to make sure that we're safe. Now, the last thing I would say is we're better off today than we were yesterday. Mm-hmm. Every day that goes by, it's going to get warmer. And there's going to be more sunshine, and there's going to be a lesser and lesser and lesser probability of a bad outcome. We've got to play this day by day.
One of the things.
Let me talk 1 second. Oh, I'm sorry,
Please,
Kathy.
one thing. The reason why the reason to do it, if there's a case that we would announce that, even if it's on a weekend, is not because it changes things dramatically. It's because we said we'd be honest and open with you, and we would announce it when it happens. So that's the reason why there would be an announcement at that time.
Yeah, and further, sometimes we don't get these reports on the tests until 8 or 9 at night. So what we will do in that case is put out a press release, so you have the information, and then have a press conference the next day. So, and the governor did say last week we won't have these on Saturday or Sunday unless we end up with a positive case, and then we would have one. So,
or unless you end up with a real need to be here.
Right.
How long does it take a test to be completed?
The turnaround we've been doing right now has been about 24 hours. We have to batch them because otherwise we don't use our reagents fully. And conserve those. So the actual testing, it depends on how much they have to do for preliminary testing, but it's typically around 6 or 7 hours when it runs over the day. So that's roughly what it does, and we can do them in batches of 20 or so.
And then we will provide a public update every evening when that happens, once we get the results, and that will be posted on our website. So we're trying to be totally open, provide you information as we get it.
You may see changing times because sometimes we wait until we have a grouping that will fully utilize the resources. But sometimes, occasionally, if we've got 1 or 2, we will say, okay, we'll run it the next day. So I would say when generally we're aiming for a 1 to 3 day turnaround time. So far, we've been able to keep that.
With the state saying that we're meeting here every day, is this room being sanitized? Is the Capitol building being sanitized? Other public state buildings?
We have folks, yes.
It takes some extra sanitation for y'all. No, I'm just teasing everyone. Believe me, we're working on everything. Everything's good, not good. Concerned, don't be worried.
There are students who come back from trips in Europe, which is now the epicenter of the virus.
There is still, if you're coming from a level 2, level 3 country, then there would be the standard travel precautions when you come back of 14 days usually. Depends on where they're coming back from.
Okay, we're done.
Thank you all.
We're done. Thank y'all.